Be certain to read the product instructions, warnings, and information for the patient contained in the package and advise the patient accordingly. Determine the patient's initial shade for your records. Both you and the patient should wear protective eyewear during the procedure. Place a self-supporting lip and cheek retractor followed by the Ultradent ISO block. Instruct the patient to hold the ISO block in place with gentle but firm biting pressure. Remove the Luer lock cap from the Opel Dam green syringe and securely attach a micro 20 gauge tip. Verify flow prior to placing intraorally. Completely rinse and air dry the teeth, then express a continuous bead of Opel Dam green along the gingival margin, overlapping approximately 0.5mm onto the enamel. Extend the resin one tooth beyond the last tooth to be bleached, and continue building the barrier apically until it is 4 to 6mm high and 1.5 to 2mm thick. Using the mouth mirror, look up the long axis of the teeth and reapply the resin to any minute openings. Light cure the resin for 20 seconds per arch using a scanning motion. Carefully check the resin cure with an instrument. Before mixing Opalescence Boost, check that the red syringe is securely attached to the clear syringe. Quickly and forcefully depress the small clear plunger into the middle small clear syringe to rupture the internal membrane. Depress the red plunger, forcing the contents of the red syringe into the clear syringe. Reverse the action and mix a minimum of 50 times total, or 25 times on each side. Be sure to finish with all the mixed gel in the red syringe. Twist to separate the two syringes. Discard the clear, empty syringe and attach the micro 20 gauge FX tip onto the red syringe. Verify flow prior to applying intraorally. If you feel any resistance, do not proceed. Attach a new tip and test the flow again before applying Opalescence Boost to the teeth. Apply a 0.5 to 1mm thick layer of gel over the labial surface of the teeth. Allow the gel to remain on the teeth for 20 minutes, periodically checking and reapplying the gel to areas that are thinned or need replenishing. Periodically suction saliva with saliva ejector, as needed. Suction the gel from the teeth using the Luer vac and surgical suction tip. To avoid gel splatter, do not use water while suctioning gel. Use caution not to dislodge the isolation barrier. Tip: clear suction periodically with water. Evaluate the shade change after each application and monitor the patient for sensitivity and irritation. Repeat application 1 to 2 times or until the desired results are achieved. We do not recommend exceeding 3 applications per visit. Suction the gel from the teeth using the Luer vac and surgical suction tip, then thoroughly rinse teeth with an air water spray and the high volume suction. Once the desired shade of white is achieved, or you have completed 3 applications, use a dental instrument to remove the cured Opel Dam resin barrier.